Thank you to OREF for having me today, and sorry to Dr. Margetko for crossing to the dark side and talking about MIS. I'm Jonathan Ledesma. I'm one of the interns at the University of Illinois, talking about a relatively new technique for the treatment of lumbar spinal stenosis in the setting of degenerative spondy called pedicle lengthening osteotomy. And I have no disclosures. So the problem, lumbar spinal stenosis, commonly encountered in the spine surgeon's office, affecting up to 70 million people worldwide, with that number increasing as the population continues to age. Traditional treatment for this has been open decompression and fusion, and while less invasive techniques like lateral access and interspinous spacers have been developed, they have not yet supplanted traditional open decompression. One of these techniques is a pedicle lengthening osteotomy, titled PLO, which involves making a percutaneous cut at the base of the pedicle where it meets the vertebral body. The osteotomy site is then lengthened using a biaxial screw at the osteotomy site, and then bony healing fills in the gap and reconstitutes the pedicle in a lengthened state. Here are some pre- and post-operative axial CT cuts demonstrating an increased canal area in red. And here's a diagram demonstrating intraop fluoros of the technique. So first, there is cannulation of the pedicle, followed by insertion of a radial saw through the pedicle to make cuts at the base, and then finally insertion of this biaxial screw, which distracts across the osteotomy site. As stated, this is a relatively new technique. Only 8 studies exist in the literature, the most important of which being from Liavik et al., looking at 20 patients in a prospective pilot trial, looking at this technique and found significant improvements in all patient-reported outcomes up to 5 years after surgery. They also found a mean increase in spinal canal area up to 115%. Therefore, our question was, how does this technique stack up to traditional open surgery? So a prospective multi-center randomized controlled trial was conducted to compare clinical and operative data between open TLIF and pedicle lengthening osteotomy. Inclusion criteria, ages 40 through 80 years old with symptomatic lumbar stenosis and grade 1 spondy that had to fail 6 months of non-operative management. We included 3 academic centers, and after randomization, we had 7 patients in the pedicle lengthening group and 6 in the open TLIF group. Data collected operatively included surgical duration, blood loss, fluoro time, and hospital stay in days. Patient-reported outcomes were collected at baseline, 6 weeks post-op, 3 months, 6 months, and 12 months after surgery, and these included ZCQ, or Zurich Claudication Questionnaire, and the VAS score for leg. So starting with the operative data, we saw, as we would expect with a minimally invasive procedure, the surgical duration was about 30% shorter in the pedicle lengthening group compared to open TLIF. Blood loss, about 20% in the PLO group compared to open TLIF, and hospital length of stay was 4 days compared to about 8 in the open TLIF group. At the cost of longer fluoroscopy time, it was about 3 times longer in the PLO group, and all of these reached statistical significance. Regarding patient-reported outcome data, first starting with the pedicle lengthening group, we saw significant improvements compared to baseline at 6 weeks, 3 months, and 6 months in the pedicle lengthening group, compared to 6 months and 12 months in the open TLIF group. Interestingly, we only saw improvements in VAS leg scores in the pedicle lengthening group at all time points compared to none in the open TLIF. Regarding operative complications, we had none over the course of the 1-year span. We had no instances of nerve root laceration, dural tear, revision surgery, or Hogberg complication over the 1-year period. So for discussion, we were mainly limited by our sample size, which we think was interrupted due to the pandemic, but the statistically significant results that we observed likely indicate a strong treatment effect at play for our trial. This study adds further data to the body of literature suggesting that this technique is a useful tool in the box and another method for the treatment of degenerative spondy, and adds further understanding to confirm that this technique performs favorably in comparison to open TLIF. So in conclusion, compared to TLIF, this pedicle lengthening technique had less blood loss, shorter surgical duration, shorter hospital stay, but more intraoperative fluoroscopy, and that PLO was more effective in achieving leg pain for patients with lumbar stenosis in the setting of degenerative spondy during the first 12 months of OPT compared to open TLIF. Thank you.